morning, ladies and gentlemen. Now, some genetics. I would like to talk about non-invasive prenatal testing for rare chromosome abnormalities. I am Márton Kónya from Czeizel Institute, where I lead diagnostic and screening lab for prenatal chromosome abnormalities. We would like to help pregnant women who are oversensitive for hard decisions. And yes, we are very happy when we can tell them good news, but I think it's much more important if we get some thank you after bad news, because that means our work was good. We have two ongoing projects. The first one is the accuracy of non-invasive prenatal testing for rare chromosome abnormalities. The second, where we would like to study the background of false positive cases. And we plan to work with our own database. The first one is the accuracy of non-invasive prenatal testing for rare chromosome abnormalities. What is the NIPT? Is a non-invasive prenatal testing. Is non-invasive because it cannot cause a miscarriage. This is very, very good technique for frequent chromosome abnormalities like Down syndrome, Edwards syndrome, and Patau syndrome. The DNA from the placenta is go to the maternal blood, and we can measure the DNA level in maternal blood. And for example, if there is more DNA from chromosome 21, it means the fetus is high risk for affected with Down syndrome. These techniques are developed very fast, and patients want to get all genetic information. I bring you an image. We catched this trisomy 7 few weeks ago. These are the rare chromosome abnormalities. The only problem, these cases, so many times false positive cases, and we have to do invasive procedure that can cause miscarriage and cause stress for the patient. Our aim to test PPV of NIPT of each chromosome abnormalities, and we would like to check the relative frequency of each rare chromosome abnormalities. We focus on NIPT and rare chromosome abnormalities because frequent chromosome abnormalities, we have no so many questions. Our hypothesis, if the NIPT finds almost as many chromosome abnormalities like amniocentesis, but there are so many, not so many, but many more discordant results. We would like to see evidence on the accuracy of NIPT, and we try to decrease the unnecessary invasive procedures. First study, we used Medline and Embase with this search key. We have 4,000 records, and now we started to work with 27 for data extractions. The second one is, what is the background of false positive cases? The false positive cases is not really false positive. We also call it discordant cases because we measure an extra DNA in maternal blood. That means there is an extra DNA, just maybe the fetus is not affected. Yeah, we have to talk about the mosaicisms. That's 3 types of mosaicisms. It's generalized when both the placenta and the fetus is affected. That means the NIPT will be positive and the amniocentesis will be positive also. When only the placenta is affected, but the fetus is not, then the NIPT result will be positive, but the amniocentesis, diagnostics test will be negative. The third one, when only the fetus is affected, that is a false negative cases. Luckily, it's very, very, very rare. Placental mosaicism can cause some problems in the placenta. Of course, there can be chromosomal abnormalities when the placenta cannot work well and cause a smaller baby or stillbirth or preeclampsia. False positive cases can be maternal origin, mainly maternal malignancy. It is very, very high risk if there are complex chromosome abnormalities in NIPT. Now there is any protocol about this case for these cases. That it's a very big moral problem for us now. Okay, clinical question: can we predict pregnancy complications with these false positive cases? Or how can we handle the complex NIPT cases where the fetus is not affected? If we know, the background can be a maternal malignancy. Here, same groups, and we check the outcomes. And we think we can predict, if we can predict pregnancy problems, then we can decrease the problems during the pregnancy in these cases. Okay, our clinical implication decrease the mortality and pregnancy complication with the, following these false positive cases. The databases are limited because this is very, very new things, so we have to search a lot. We have some key articles now, but these outcomes is always secondary outcomes. It's harder to work with these. Thank you for your attention, and I bring a quote for Professor Czeizel. From time to time, the glitter of the precious stone can also be seen from the seemingly gray gravel. Thank you.
Hello, my name is Anette Sabo. Thank you for your presentation. And I just have a technical question. With your first topic, why did you choose to only do the search into databases?
Because we checked other databases, and these two was usable for us.
But, for example, Cochrane wasn't?
No, not really.
And how come?
We did not find any good article in Cochrane.
And you looked through all the articles with the search key?
It was very small number of articles, and just checked, and there was no usable article.
Okay, thank you.
Congratulations on your presentation.
Thank you.
I also had a similar question. Maybe if you can at least write like Cochrane 0 hits or any reason, because I was as well wondering. And one more thing regarding the first project. So if I understood correctly, you used paired framework, and the reference test for you with which you would compare the positive predictive value would be amniocentesis, or can you give me some information regarding this? Like, how are you going to compare this test?
Yeah, because NIPT is a screening test, and it's a false positive, means NIPT is positive and amniocentesis is negative. Because amniocentesis, where we can check, when we can see fetal cells, and NIPT is, we checked maternal blood, and maternal blood contains only a placental DNA, not fetal DNA. That's why we can compare NIPT with amniocentesis.
I was more thinking about the first project, and this one is the second, I think. This one, like which framework you were using? Maybe I don't know, maybe it's different for screening methods, but I was thinking that you are using the framework like paired, And if you are comparing with some reference test. That was my question. And what would be the reference test?
The reference test is amniocentesis, yes.
Okay, thank you, because I see it also there, so I was just wondering. Thank you.